Recording in progress.
Hi guys, good evening. Thank you for joining us for another session about communication skills dedicated for IMG. I'm Natalie. I'm one of the F2s. I'm currently based in Lincolnshire Hospital. Thank you once again for joining, and we really appreciate that. So we'll move on. So today's topic will be ethical dilemma. It's mainly about professional responsibility as well as patient safety. Okay. So this is an example scenario that we might encounter um, while we're working. So the scenario is about a junior doctor working in a busy hospital. So one morning, as you arrive for your shift, you notice a colleague, Dr. Smith, in the hospital cafeteria drinking from a flask. And you observe that the liquid in the flask appears to be alcoholic in nature, and Dr. Smith is scheduled to start their shift in just a few minutes, and you're now faced with an ethical dilemma. Okay, so basically, the content that we're gonna tell you about will be approaches um for such scenario. Okay, so basically, what ethical dilemma um is sometimes in where in a situation you can be quite um contradicted with the values that you were told. So, for example, for the situation that we showed you earlier on, which say that your colleague might have drinking habits, and also at the same time your colleague is going to see a patient, and that sort of thing will actually affect patient safety. So you have a duty to ensure patient safety and at the same time uphold professional standards. So you know that alcohol consumption before a shift will impair judgment, coordination, and decision-making abilities, and potentially compromising patient care. And on the other hand, you also would consider the potential consequences of reporting your colleague, such as damaging professional relationships, creating conflicts, and also negatively affecting Dr. Smith's career. So first, in such situation, how would you want to approach that? So first, you want to establish rapport. So you say things like, "Hi, Dr. Smith. Appreciate I've been working alongside you and the dedication you bring to our team." And so you could say things like recognize that maintaining a work-life balance can be difficult, and we all have our personal struggles, and tell them that you're always here to support them and you understand the pressure that we usually face in our roles. So these are just a few examples that you could use to try to initiate conversation with your colleague, just to avoid the awkwardness. It's not something that you should follow indefinitely. It's just something that to keep in mind if you want to initiate conversation. These are the phrases that you could be using. Okay. So the second one would be expressing concern and initiating a conversation. So after greeting rapport, after asking how are they and how are things doing, you want to say, so you notice them drinking from a flask, and always emphasize about patient safety. Okay, the point of you bringing up that point of him drinking in the cafeteria is because you're concerned of patient safety. Okay, so tell them exactly how you felt, and try to lead them to tell you more about why they are doing such thing. Okay, so you sh could be sharing the ethical concerns because as you can tell, Dr. Smith, the reason why um you'll be saying that is because as healthcare professionals, we have a responsibility to ensure patient safety and to provide the best possible care. And alcohol consumption before a shift can impair judgment and affect patient care. And the other point is that I can tell them drinking alcohol before a shift would raise ethical concerns as it may compromise your ability to make sound medical decisions and potentially jeopardize patient safety. So these are the examples that you could be using because such phrases acknowledges the potential risk or consequences associating with reporting the situation. You know, it could actually strain relationships or have negative effects on your colleague's career. So by saying such thing shows that you're aware of the broader context and also the need to carefully consider the potential outcomes. Okay, so moving on to the next point, I will hand it over to my colleague Oscar. Thank you so much for listening.
So hi, I'm Oscar. So I'm also one of the FTU. So me and Natalie and me, we co-organize this, hoping that this will help IMG to adjust better. So with all these tips. So just continuing from her point, moving on to the next one, encouraging open dialogue. So I believe in dealing in this kind of situation, you must give the person a chance to, sort of express whatever they are thinking. So you understand what's going on. Basically, you're trying to explore. You can say things like, I think it's important that we have an open and honest conversation about this. Your well-being and our patient's safety are both important considerations. Or alternatively, you can say, I would like to hear your perspective on this matter and discuss how we can ensure the best care for our patients while addressing any concern. So by extracting more information, you want to understand the nature of his behavior, or even, you want to figure out ways and solutions to help him. And lastly, suggesting a collaborative approach. So you want him to feel like, you guys are on the same team, on the same page. You are here to solve the problem and not the other way around. Okay? So you want him to be on your side. So things like, perhaps we can work together to find a solution that ensures patient safety and supports you in maintaining your well-being. Or I believe it would be beneficial if we involve our supervisor or a senior colleague to provide guidance and support in this situation. You do not want them to interpret your action as if you want to, sabotage their career, and you want them to understand that you are acting out of their best interests. Just like how you would advocate for a patient, and right now you're just doing it for your colleague. If you you know if you could convince him, and I believe that will be a first step to solving the situation. Okay, so we have the SPICE structure as well. Actually, it's sort of like a summary of whatever we have said. I'm just going to try to go through it really quickly, just so that we can consolidate whatever we have learned today. First of all, seek information. Try to have a full grasp of the situation, patient safety, assess if there's any threat, immediate threat, or if he has done anything in the past that might threaten patient safety. Initiative, so offer help. What can you do to help your colleague in this situation? Escalate, knowing how to escalate to the appropriate level, consultant, your education supervisor, clinical supervisor, clinical lead, medical director, chief executive, or sometimes inevitably GMC. Lastly, support. Try to offer individual support, or even team support if if there is someone else with you. So never make the patient feel excluded, isolated. Uh, we're here to help him and we want to reach a solution rather than trying to accuse him of doing something bad. In some way, always try to ensure patient safety, maintain professionalism, offer support to your colleague, try to find out more information about the situation, take initiative, act to resolve. And if resolution is not possible, we always need to try to escalate appropriately. So I'm just going to share a YouTube video again. And about a difficult situation. Okay. So um so as much as this video does not directly correlate with the previous scenario, I do think we can appreciate a few things. First of all, this is definitely a difficult situation for the GP to be in. And secondly, uh, there are a lot of ethnicities exist in the UK right now, and we must be really mindful of the cultural differences. And thirdly, I really appreciate that, he discussed it with a colleague and then how he can act better next time. And I believe that is the collaborative spirits that we're looking for, in resolving issue in the NHS. Okay, so we have come to the end of our session. Thank you very much for attending. And sorry, and yeah, please fill in the feedback form that I've linked in the comment section. I'll stop the recording now and open the floor for questions.